Herb Riband.
Hi, Herb. Nice to hear you. You're mostly online, but I don't know if Nancy or Marcia are ready.
Yes,
Yes?
I'm right here, Marcia.
That's great. Hi, Marcia. Hi, Nancy. And Martin.
Nancy Edwards also.
Martin, are you already there? Martin Rook. Martin Rook, we're still waiting for Martin to pop up. Are you still there, Martin? Are you here? The technicians are working on it. It's difficult because we got 4 continents. Here we are. At least we have the ambassadors already inside. Good to have you there. I can see that you're calling from Switzerland, Herb, because they have a flag on your right shoulder. That's excellent.
Not only that, I have more proof. So yes, indeed. Greetings from Switzerland.
Excellent. Good to hear. And Nancy, you're calling from the USA, I suppose.
Yes, correct.
Okay. And Marcia from Brazil.
Yes.
Okay, great. And Martin is supposed to be calling from the Netherlands. And we are still waiting for him. Otherwise, if we're still waiting, we'll see if I can start already the panel. And well, what's actually the meant to do is you're all ambassadors of the value-based healthcare movement, and I would like to ask you, what is the main successes in your country? Maybe I should start with Brazil. Marcia, what could you offer us as one of the big successes, or the thing you would like to most of presenting what is going on in Brazil at this moment?
Okay, thank you very much. We are in Latin America, not only in Brazil, taking the early steps on value-based healthcare, but I see there is a lot of talking about it, not too many initiatives, but I would mention the first initiative is the agreement between ICHAM and the National Hospital Organization for private hospitals. So they have been successful in implementing the standard sets for heart failure and for osteoarthritis and cancer and breast cancer for 16 hospitals. So they are having this movement in different states in Brazil. I also am leading a project for Latin America, for Brazil, Argentina, Colombia, Chile, and Mexico, where we were able to ask 70 organizations how they are implementing value-based healthcare in Latin America. And what we see is that 50% are able to organize around one medical condition, and 40% are already collecting patient-reported outcomes. But only 24% are able to measure costs at the condition level. And when you look at the payment models, we see that 57% are still pure fee-for-service, but we are glad to see that 31% are doing fee-for-service together with another kind of payment like bundle or capitation and some other payments, and 11%, mainly the public hospitals, are doing global budgets. So this is like an overview of what we have been doing here in Brazil.
Well, certainly impressive, Marcia. Thanks for sharing this with us. Nancy, what would you say? What is a nice example of value-based healthcare in your country, or the project you have advised, because you have worked in different countries, as I know. Go ahead.
I agree with Marcia there. We have a lot of interest and a lot of discussions. However, I was able to move a project forward with one of our very large New York City hospitals. They have a very unique pediatric unit that was already functioning as a multidisciplinary integrated practice unit. And they had standardized protocols and their outcomes were stellar, but they were frustrated that they weren't receiving patients that they felt they deserved. And so I said, well, why don't you make this initiative a value-based healthcare initiative? And in order to do that, you'll need to add the cost piece of the equation, because they knew everything else and everything else was in place, But in order for them to negotiate with payers, they would have to add the cost element. And everything was moving forward really well. We were about to have several meetings with the CFO of the system. And unfortunately, that's when the health system was inundated with COVID as part of the New York initiative.
Right.
And so right now our project is on hold until the CFO can deal with what they consider more pressing financial issues to get the system back, on the financial path to health that they feel they should be on. But it's very exciting. Everyone at the hospital is very excited about it. It's just we're in a waiting pattern right now.
Okay, thanks for sharing that. Yeah, we all hope that the COVID will pass quickly. But I think no one of us know how quickly it will pass. And it will make some more space to launch this type of initiatives. Herb, do you have something from Switzerland to report, which is worth mentioning to us, to the audience?
Yes, good afternoon, everyone. Thank you for the opportunity to be here. Switzerland is known for many things, but unfortunately, value-based healthcare is not one of them. That's probably why Fred Van Eenenum fired the last ambassador to Switzerland and brought me in 10 months ago. But the good news is I see progress, and I'll give you 3 examples. One is the Basel University Hospital, which has implemented a very sophisticated value-based healthcare program focusing on stroke and breast cancer. So I give them full credit. There's another group in Basel that is working to bring value-based healthcare to startups. So let's not just focus on large organizations. Let's try to instill the culture in up-and-coming entities, which I think is great. And third, there's a Hospital de la Tour in Geneva, which has some former Medtronic executives and a very impressive value-based healthcare program. So lots of work to do here, but several promising starts that I hope to report on next year if I'm still in my position.
Right, thank you so much. I just heard that Marta he can't join us anymore. He had some other things to do. That's certainly a loss because he's a great advocate of value-based healthcare. But nevertheless, you were here. You were the great ambassadors for this movement, and I'm very glad that you shared one of the big examples you have from your country. Of course, there are a lot more examples. Well, we just heard of them, of all the nominees, so thank God we are not the only ones active in value-based healthcare, but a lot of us are doing that at this moment. I'm looking at the technicians, and I think where I'm going to move to the last poll, and it's coming within a couple of seconds. And I hope it's, we are still waiting for the poll popping up in your screen. It's a one short poll, and maybe otherwise we should go to the introduction of Sebastian Bloch. Are we going to, no, the poll is over there. Yes, I can see it. The poll will be: the concept of value-based healthcare is universal and could be applied successfully within every country. Well, I don't have to explain that. The ambassador will probably say yes. But,
Absolutely.
and here's the poll, and well, that's obviously, and it's unfortunately. I would love to hear from the people who said no, why they're saying that, but I'm afraid they will have to read that on the chat. So I invite all the people who said no, that's not a universal concept, to explain it on the chat so everyone can read it on the chat, because I think a lot of the audience would actually say yes, it should be universal. But again, it's often the opposite opinion which can be interested to move further. So again, I want to thank the ambassadors for joining us. Thank you so much for sharing the big successes in your country. And I would like to go to the next part of the program, is actually what we're all here for, is the awards ceremonies. And I would like to start with giving the floor to Sebastian Bloch of Hartwacht, or in English, Heart Watch, winner of the 2019 Collaboration Award, and he will announce the 2020 winner of the Dragon Grants. And I hope Sebastian Bloch is nearly going online. I can see at least some fireworks going on in the